This is the new Kyoto Kagaku Nasopharyngeal Swab Collection Simulator. The set includes an anatomical head model, one set of replacement pads, a syringe, a plastic cup, a set of coloring sticks, and an anatomical explanation panel. First, remove the mask. Then, disassemble the nasal cavity part. Position the replacement pad. Replace back the nasal cavity part and mask. Prepare the simulated nasopharyngeal secretion by dissolving a coloring stick in water. Fill the syringe with simulated nasopharyngeal secretion. Then inject the blue liquid into the plastic tube from the neck with the syringe. Disconnect the syringe from the tube. Now the model is ready to use. Insert the swab through the nasal cavity. If the swab is not inserted at the correct angle and depth, it will not be colored blue. Only when the swab touches the correct area of the pharynx will it be colored blue. Practice with a tongue depressor in the oral cavity is also possible, but without simulated sample collection ability. Connect the syringe to the plastic tube and take out the liquid inside the simulator. Remove the mask and the nasal cavity part to take out the replacement pad. Wash out the pad with water and squeeze it perfectly. Place the pad back inside the simulator. Replace the nasal cavity part and the mask. Now the simulator can be stored. Thank you for watching.